Welcome to this edition of House Call. Did you know that lung cancer is the leading cancer killer of men and women in the United States? And while most of us associate lung cancer with smoking, there's a significant increase of lung cancer in non-smokers. While some of the contributing reasons are unknown, radon is a known risk factor contributed to a lot of our new smoking cases. I'm Sammy Mansfield with the Sarah Cannon Cancer Institute, and I'm here today with Dr. Nisreen Haideri, who's a board certified practicing oncologist and hematologist in Kansas City. She's been with us here for more than 10 years, practicing in our backyards, and she has significant experience in lung cancer. Dr. Haideri, welcome to our house call today. How are you?
I'm good. Thank you, Sammy.
Absolutely. Thanks for talking about this really interesting and, in my mind, not very understood topic. First of all, tell us, what is radon and why should we be concerned?
Yeah, so when it comes to radon, it's basically an element, and it's a gaseous decay product of uranium and radium. And we started learning about radon as a cause of lung cancer when we learned about uranium miners, and we started noticing increased risk of lung cancer, and they were being diagnosed with lung cancer. So
Wow.
basically what this gas does is that it is capable of damaging the lung tissue
Hmm.
by emitting alpha particles, and that increases the risk of lung cancer.
So how is it that somebody who's, not a minor, like how is it that a homeowner is at risk of radon, there in their home? Like, do they smell it? Do they know it's there? What should homeowners know?
So basically, radon is also present in soil, rock, and groundwater, and it can accumulate in homes. So therefore, we are learning about some more implications of radon in addition to smoking as a risk factor for lung cancer.
Interesting. Are you seeing more potentially radon, cases that would be impacted by radon, like non-smokers or younger smokers in your practice? I mean, obviously you've got 10 plus years of experience. What are you seeing day to day?
So basically, when it comes to the causes of lung cancer, radon is the number second cause of lung cancer after smoking. But when it comes to environmental factors, it actually is the second leading cause also of lung cancer. So what we see is like this year we saw like 21,000 lung cancer deaths, and approximately 29,000 of them were in non-smokers.
Wow. And do you think that, from your research, I've heard that radon is more prevalent here in the Midwest due to like the soil and rocks that we're sitting on. Is that in fact true, or is that something that's kind of speculation? Some people think, oh, that's a hoax. What do you see? What does the science tell us about being located in the Midwest and our risks of radon?
Well, when it comes to our state and our neighboring states, we are seeing increased, connection to radon and as a cause of lung cancer, especially also in non-smokers.
Do you ever talk to patients and hear them say, especially you've got younger patients, that they didn't know that radon was a risk factor? They didn't know anything about testing. I mean, what are the patients kind of talking about? Or are they even aware that this is a risk factor that they're living in?
So a lot of patients are not aware of the radon as a risk factor. When it comes to lung cancer, it's typically just the smoking.
Hmm.
But I'm talking to patients more about getting their homes tested for radon and also looking at other causes of lung cancer, which includes vaping in the younger population. Um, Besides radon as an environmental factor, asbestos, arsenic, chromium are other environmental factors that we have to keep in mind if anybody has had exposure to that. Indoor pollutants like
Hmm.
smoke, burning coal, cooking oil smoke can also contribute. So there are other risk factors like even exposure to secondhand smoke. Now, we are learning that maybe prior history of lung disease or radiation to the lung could also be linked to developing lung cancer. We are
Hmm.
not clear about the role of HPV virus, the human papilloma virus, and its linkage to as a causal factor for lung cancer. Now, in women, we have learned about estrogen receptors, especially the beta type, being exposed in the lung tissue, and maybe that may also have some connection to lung cancer, especially in women who are non-smokers.
Interesting. Well, with lung cancer being the number one cancer killer in the United States, I think people always are like, how can I prevent this disease that could take my life? And we're obviously seeing these links in radon as something that we can all do. Have you, what are your thoughts around, is it too late to test a home? Should everybody get their home tested? As you know, as a professional, what would you recommend to your neighbors or your friends that they should do?
I mean, ideally, as when you're moving into a new home, we all should get our homes tested for radon. But especially if there is somebody who's smoking in the house, I would definitely promote radon testing at home, because we have seen an interactive effect of radon exposure and smoking together as a cumulative effect in causing lung cancer.
So you're telling me that if you're already a smoker, I mean, certainly you're at risk, but if you're a smoker and your house has radon, your risk is increased. Is that what we're learning today?
Correct.
Okay. So I think it's really important for people to know there are things that they can do to reduce their risk or to not increase their risk. Talk to us a little bit. Are we seeing anything about children? Are we concerned that children that are, being raised in homes with radon could be developing cancer themselves? What should we know?
So basically, in the pediatric population, there may be radon exposure linked to some other types of cancer, like childhood leukemia. But the evidence for such connection is mixed, and I think future studies will kind of, throw more light on this connection. So basically, we also have learned as the relationship between the time of exposure. So if somebody has been exposed to radon like close to 15 to 25 years of their life, then they have a more chance of developing a harmful effect from radon.
Wow, good to know. Thank you, Dr. Haideri, for your information today. This has been really helpful. Is there anything else you would want to add for the viewers today?
Well, my only, advice to everybody who is smoking, we do have low-dose CT screening now for the lung as an accepted recommendation for lung cancer screening. So that is something that we can always, discuss with a primary care doctor, in addition to mammograms and colonoscopy and pap smears to consider that.
Excellent information. And can you reiterate that for one moment? So since we have these low dose screenings, who qualifies for these screenings if they're a smoker? What's the amount of smoking history that qualifies for this?
So patients who are have smoked for more than 30 years, and if you're above 65 years of age, you qualify for low-dose CT screening of the lung on an annual basis.
Okay. And that would help us identify a lung cancer much earlier. Is that correct?
Exactly. So we can pick up these small lung cancers, which could be still cured by surgery or by radiation, and it has a benefit effect on survival.
And remind us, they should reach out to a primary care for that referral or find more information. Okay. Excellent. Great to know. We definitely want to prevent these cancers or reduce our risk wherever we can, because obviously we know that it's definitely important for all of us to live better longer. Thanks so much for joining our house call today. I hope you have a great day.
Thank you, Sammy, and wish you the same.
Wonderful.